January 11th, 2014, I found out I was pregnant, about 4 weeks pregnant. The truth, I was so stunned, I didn't know where to start. For Virginia Copeland and many others, I'm sure it's the same story.
I was in shock. It was like the first stage was just shock.
So, like Copeland, I thought something must be wrong with my home pregnancy test, and I took another.
I went on Google and looked up maybe pregnancy tests that could be wrong, and I was like, oh, it's probably that.
But it turns out nowadays, home pregnancy tests are pretty accurate. A girlfriend told me to make an appointment with an OBGYN as soon as possible.
The women who come and who seek prenatal care sooner have better outcomes for their babies. For example, there are many women who are not taking adequate levels of folic acid, and we know that folic acid is important for preventing neural tube defects.
In New York City, health officials fault a lack of prenatal care for many of the poor infant health outcomes we see. Those babies are 3 times more likely to have a low birth weight and 5 times more likely to die, compared with babies born from mothers who do get care early. Director of Women's Services for the Community Healthcare Network, Sharon Griffith, says some women are just unaware of the impact that some habits could have on the fetus.
Smoking is one good example of that. Nutrition also plays a role in babies who are born low birth weight. Medical conditions can sometimes do that. Women who are diabetic can have either large babies or babies that are small for gestational age.
At my first visit to the obstetrician, I was 6 weeks pregnant, but my doctor was unable to see the fetus. By week 8, it was clear a baby was growing. By week 9, I was excited and jumped into selfie mode. And by just 12 weeks, we were able to see even more in my ultrasound. In part 2 of my Baby Steps series, we'll take a look at some of the routine tests all aspiring moms should expect, with video from my actual doctor appointments. Erin Billups, New York 1.